So now that we're able to pull the structured and the unstructured data out of the electronic health record, we can use that to really understand the stories of patients regardless of whether or not they were enrolled in a clinical trial. So as we all know, only 3 to 4% of American adults with cancer get enrolled on clinical trials, and at present, that's most of what we know about how to manage patients, is what we learn from that setting. So 96% of the Americans, adult Americans with cancer, their journeys aren't really being used to learn. Patients really want that, and it's data that we can't let pass us by. So by being able to extract data from the routine course of care and learn from those patients, that's not going to replace traditional clinical trials, but it can augment what we know and tell us a lot of things about what happens in the real world when, for instance, new targeted therapies go out. They're potentially very toxic, they potentially work really well, they potentially cost, they often cost a ton of money, but we really need to understand what's happening when they get moved from the very well-defined, rigorous clinical trial mode to the real world.